Hi, I'm Dr. Jerry Hesch, a physical therapist in Aurora, Colorado, and I work at Hesch Institute. And this is my client who is a triathlete and a physical therapist. And he injured himself, and we found what we name a downslip pattern of the left hemipelvis, ilium downslip. And we corrected that, restored normal movement throughout his left hemipelvis, but what he presents with now is with a side-bent sacrum. And this is so rare. It is so rare for me to see someone with a side-bent sacrum, and I don't recall seeing it after correcting a downslip. So I wanted to capture this unique presentation. So I think you'll be able to see with the film, and of course I did an extensive eval and did multiple directional mobility testing, but I'm only going to focus on the elements of the side-bent sacrum. His left ILA of the sacrum is inferior, so my left thumb being underneath the ILA on both sides is lower on the left-hand side. In terms of mobility, I can push superiorly and take up the slack. Now when I do that, I see his upper body move. So the force translates through the right SI joint on through the whole spine and the upper body. And I can then spring it, and there's an additional movement, maybe you can show that in the upper body, that when I spring it, it does move and it recoils, okay? And now we're going to do the same test on the left side, except I cannot take up the slack. I'm pushing with an equal amount of force as we did on the right, and there's no movement. And now I'm doubling that force, and there's no give. The slack is already taken up, the joint is stuck, it's not moving, it's not allowing me to induce a vertical or side bending motion through his left sacroiliac joint. And so I'm going to treat this, which is really simple. Can you side bend your upper body to the right? Okay. And so we get upper body side bending, and all I'm going to do is take up the slack, and I'm going to oscillate it 3 times firmly. Okay, straighten out please. The ILAs are now symmetrical. I can now take up the slack. Can you show the upper body moving when I do that? So I can now take up the slack, I can spring it and it recoils, spring and recoils. And this might involve restriction at the L5-S1 facet and side bending. It might involve the SI joint. No one knows. No one's done the research. We don't have biomechanical research to tell us this is a valid construct. But we're treating it based on function. And what we found was a loss of normal physiological spring recoil mobility through the joint in a specific direction. Now earlier, before we treated this, you had pain with hip extension. Can we test it again? Mm-hmm. Okay. So at the count of 3, give me everything you got. 1, 2, 3.
Yeah.
It's a lot stronger than it was before. Do you still feel discomfort?
Yeah, I still feel it there.
Okay. And step down and walk around.
Okay. It might just be from that extension there.
Yes.
So kind of right in that spot.
Okay. Very good. So I'll take what I can get. We gain mobility and we gain some strength, so we removed some inhibition of your hip extensor. And we'll keep looking at it and keep treating it. And the mechanism of injury was certainly interesting.
That's weird.
It was an unusual force that translated through your body. Anyway, I thank you very much.